Going ahead, it's time for our first panel discussion titled Profit by Design, Designing the Future of Healthcare Space. So going ahead, I'd now like to welcome the session chair, Joy Chakraborty, Chief Operating Officer, Hinduja Hospital, along with our distinguished speakers. So now going ahead and inviting our speakers, we have Padma Shri Dr. Ramakant Deshpande, Chairman, Asian Cancer Institute, Cumballa Hill Hospital. Next, we have Dr. Ahmad Mecklai, Founder and CEO, AAA Healthcare. Going ahead, we have Neeraj Lal, Regional Director, Maharashtra Region, Medicover Hospitals. Next, we have Shantanu Poredi, Architect, Urbanist, and a co-founding partner, Mobile Offices. Can we have a huge round of applause for him as well, everyone? Then we have Dr. Shilpa Tatake, Group Chief Operating Officer, Jupiter Hospitals. Next, we have Saurabh Gupta, Regional Chief Operating Officer, KIMS Hospitals. Let's give a huge round of applause to all of them. Requesting Shantanu Poredi to please join us here on the stage.
Once again, good evening to all of you, and it is my pleasure to be here among the luminaries of the healthcare industry, and in a very beautiful, evening with all of you. And the topic is also interesting, that we are talking about profit by design. So I'm seeing that by design in this stage, we have all profit-making hospital. I come from a not-for-profit hospital. So today, profit is a taboo in Indian healthcare, and we should not talk about it. But still, I'm going to make an attempt with my distinguished panelists to understand how we can create profit, we can create smart hospital, we can make it sustainable one, and still it remains patient-centric. So having said that, and in my initial opening remarks, I have spoken about what is the smart hospital, what is the kind of move we are making over the last few years. And especially I can tell you the COVID has given us a lot of lessons, and we have transformed drastically after that. And I feel that we have the agility, we have the self-sufficiency to reach that kind of expectations. So with this, I'm going to ask my first panelist, Dr. Deshpande, who doesn't require any introduction, and we consider him as a guru, and we have learned a lot from him. So here also we want to learn from you, sir, that when you talk about smart hospital, when you talk about future healthcare space, what it is exactly smart hospital? Because we are a little confused. For last several years we have seen smartphone, we have seen many things smart, but what is that smart hospital all about?
I think, thank you very much for helping me be a part of this August gathering here. And thank you, Joy, for this question. Smart hospital. See, ultimately, what does a smart person mean? A person who's a smart person, he absorbs all the questions which are asked. He notices whatever is in the surroundings. He analyzes all the data and comes back with an appropriate solution. And the same thing goes for a smart hospital. So all the data which is really required for making a patient comfortable, and the big data which goes into actually the good results of of the patients overall, and to do this with the best of the technology possible at the most financially economical kind of a way, so that we have a long-lasting kind of good result, is what we would define as a smart hospital. So you normally, you actually, how do you do this particular thing is, you create spaces which are very good, not necessarily very large, but the patient has to be really comfortable in that particular area, and so that the best results of the treatment can actually come out of that particular treatment. All the data that needs to be analyzed has to be as far as automated. So, useful of use of technology. Now, we just now saw an automatic technological kind of a program which automatically translates everything, so that the grunge work of the doctors is become much less, and the data goes into a perpetuity mode, so that it is accessible anytime. So if you increase the efficiency by reducing the particular cost and get the best results, that is what smartness is all about. As far as the Joy mentioned just now profits, right? Now profits are there everywhere. Profits are there even in private hospitals as well as in charitable hospital, but they mean different things. In charitable hospital, a profit means to get the best results comparable with the private hospitals at the least of the cost in a sustainable, scalable, and a progressive kind of a way. Whereas in case of private hospitals, you need to be answerable to your shareholders also. So you still look at the economy of operations, and you make the whole atmosphere in such a way that your the patient footfalls will keep on increasing. Your clinical results will go to the best level possible at a minimum cost. So that is the meaning of profit in case of private hospitals. So yes, profit can be there in every kind of a clinical situation. And when you do it with data-based, technology-based kind of a successful way, then that is what a smart hospital would be about.
Thank you, Dr. Deshpande. In a very short time, you have explained and you have covered the definition of smart hospital. But with that, I move on to Dr. Shilpa. My question is, when he talks about smart, efficient, and resource productivity, what are the components, or what are the, I should say, the ingredients to create a smart hospital? We have seen a couple of examples just before this panel, but if I ask you to little bit elaborate this, if you can do that.
Sure. Thank you, Mr. Joy, and thank you, Healthcare Radius, for giving the opportunity. So, Dr. Deshpande spelled out so comprehensively that very little is left for me to talk about what are the ingredients. It's like cooking something very delicious recipe and you are asking me the ingredients. In my opinion, SMART again stands basically as an acronym. So SMART doesn't only mean it is technology and data driven. SMART is also sustainable. SMART is also delivering medical care with empathy and intelligence. SMART also stands for agility, resilience, and having a proper techno integration. So these are the 5 aspects which I think are very critical when we talk about smart healthcare or smart hospital. Now, today we all discuss, and we have seen various examples just before this session where the technology integration had actually played a very crucial role, not only in reduction of the burnout of healthcare workers, which had been a long discussed topic during especially Corona times. So this is not the only aspect of technology, it is also the accuracy, it is also the precision. At the same time, we should not forget that smart also means operational efficiencies. No hospital or healthcare space is built only with the good infrastructure or having a good technology. Today, all my colleagues who are sitting over here as my industry partners, all of us actually are nearly there when we talk about technology or machines. All of us have got good funding, good investments, and today our capex or our infrastructure actually can compete with any state-of-the-art, even international facility, and in terms of ambience and the lobbies, we can compete today with any 5-star hotels. So there is very thin line during that. But what makes us special and why technology is important, because it gives us additional leverage for ensuring operational efficiency. Basically, very reason and very purpose of having any healthcare facility today in existence is patient. If we do not concentrate on the patient experience as a whole, then all what we are discussing today is whatever we adopt a technology or infrastructure, it all becomes futile. So smart, in my opinion, the basic ingredient is also empathy, well blended with the technology, used for ensuring operational efficiency. The final outcome as targeted intervention is basically the enhanced patient experience. If we all combine it together, I think there we are when it comes to smart hospital. Thank you.
Thank you, Dr. Shilpa, and you have touched upon a couple of points which are very close to my heart, like patient experience, efficiency. Now, if I go and if we try to compare with ourselves with the global scenario, the pioneer in developing patient experience is the Cleveland Clinic. If we see Cleveland Clinic and if we see some of the best centers in the Western world, we'll see they have not left anything unturned to ensure that patients are satisfied, and they call themselves the ultra-modern state-of-the-art institutes. But at the same time, what we have seen, if we look at Cleveland Clinic, they make, at least 2 years back, they have made an EBITDA of 1%. If you see, there is, fantastic technology, which is the state-of-the-art, they call in MRI in the operating room, they can use during neurosurgery, and which is there in Boston. That machine gets used only 5 times a week, and that cost installation comes around 50 crores Indian rupees. It is paid by the insurance company. So there are a lot of questions of efficiency and the kind of productivity is involved, but they can afford to do that, but we may not be. But with that background, I move on to my good friend, Dr. Neeraj Lal. I'm going to ask you, in terms of evolution and adaptation, if you compare Indian healthcare sector with the Western world, how do you see, and what kind of, can you say that we are at par, or at least we are marching towards that, and where we are today?
Thank you very much. As comparison to Western world, I think we are at par. I think we don't talk about this. I always feel very sad. We go to Google and type something, in all this presentation, US, Europe and all. I belong to one hospital which is a European chain, Medicover, which is available in 4 states in the country. So I always see the PNL of Germany, Romania and Poland and our country. So India is top. Number 2. After Poland, we are number 2, followed by Romania and Germany. So we have made a super app in our country. While I was sitting here for this presentation, I have approved 5 purchase orders. I've seen all my 6 units in Karnataka and Bangalore, what is their PNL now, and what is the target for the day, where they have achieved, whether they have started from orange, they have reached to green or not. So I think, and those apps is taken by Germany from us. So I think we are at par with them. There's no doubt about that, but I think we should talk about these things quite often. I think this is a forum where we should talk about. And at the same time, just few examples, like you were talking about operational excellence, patient experience, Cleveland Clinic EBITDA is 1%, all those things. So I feel some of the things which we can do, I think COVID is a very important, it acted as an enzyme for the healthcare properties to shift to a technological setups. I'll give you one example. Say, for example, I was in Bangalore in Rainbow Children Hospitals. So there is a tough time to manage children's in the OPD. They're having a daily OPD of 800 patients, which is coming, and patients are children's. So, and each patient, you have mother, your father, and sometimes grannies. So it is very, very difficult to manage them. So what we have done in the term of hospital infrastructure, we have created a magic motion in the OPD outpatient areas. So what this magic motion does, there is a game which is installed on the roof, and there is a game which is happening on the floor. So while you jump on that game, it moves. So then a doctor have to wait for these young patients to come to the OPD, because when their number come as per queue manager, they're still playing and their mothers are supporting them. So it make them happy, and they always say to their parents, why can't we go to that particular hospital? This is a small thing which they have done. It is hardly a less than 10 lakh thing, and which make them happy. So I think if we keep on doing these kind of thing in the hospital with the current setup, it will make a difference. Like Sunday, generally, city like Bangalore, if you don't do OPD. So we started a OPD between 10 a.m. to 2 p.m. Every Sunday is a food festival. So we have created a cafe, which is like a Sofitel hotels. You come, you see, and the waiting time for the patient is 20 to 30 minutes. They give some report, they wait. So on that day, sometime Gujarati food festival, Kerala food festival, and we have seen on each food festival is Sunday, we are running close to 1 lakh rupees for that day. So these are the few things which we have attempted to do and creating the revenue of the hospitals. So I think hospital design in the term of smart technology, of course, which I think most of the hospitals are doing, can make a difference, and entire patient experience get changed.
Thank you, Neeraj. You should have invited us when you have this food festival. And, I can tell you, he was very happy to share here that the profitability or EBITDA here in India for their chain it's much higher than the Western world. And I can tell you, this is what works in India. And probably in terms of productivity, in terms of efficiency, we stand much ahead of some of the Western world hospitals, because you know the kind of culture and all are there. Having said that, I can tell you made a risky statement, and fortunately I don't think any government officials are here. 2018, I remember there was a FICCI summit in Delhi where in the inaugural session, health minister and dignitaries were there, and in the opening remarks, the industry person told that we are making this percentage EBITDA and all, and next week the government came out with the price control policy. So, means how to do that. So that kind of, risky environment. So now I move on to Saurabh. He comes from a chain of hospitals who are coming up in multiple cities in India and coming in different geographical location. So when you're talking about the smart, basically it is nothing but, what is your future focus of hospital design. So can you share your thoughts on that, how you are doing that?
First of all, thank you, Healthcare Radius and Mr. Joy, for having me here. I represent KIMS Hospitals, which is Telugu state's biggest healthcare network. We already have 20 hospitals, and we have 5 hospitals in Maharashtra. The 5th one just started 15 days back in Thane. And I invite all of you to actually come and see, because we have tried to be smart in our own way. So what we are trying to do, first of all, I would agree with my panelists, co-panelists, that Indian hospitals are very efficient. And I was actually going through one of the report in which 3 countries, so Turkey, Singapore and Indian hospitals are at par when it comes to operational efficiency. Not only EBITDA margins, but other things, including the clinical outcomes, are one of the best in these 3 countries. The West actually comes, way behind. It is at 4th of its position. So there are many other countries which are doing much better when it comes to clinical outcomes and transparency and the adoption of technology also. So we are better. We should be proud of that. When it comes to KIMS and our methodology, we actually think about 3 different things when it comes to smartness. I think the first thing is the hospital should not look like a hospital. So the future hospitals should give a feel of a place which is a center for wellness. It should not look like where only sick people come. And we actually started with a very strong patient experience program in which we stopped calling patient a patient, which might be controversial, but we actually call them guests. Guests who have come to our place, who are unwell, and they need some of our services. So that is the hospitality part, and that is one component which KIMS has. The other thing is we create a lot of healing spaces, and now since we are expanding very fast, it is always not possible to build green hospitals, like, greenfield hospitals. We actually acquire a lot of these spaces. But we actually try to put, green spaces whenever we can. In fact, in Thane Hospital, there is a section in the lobby where we have live plants. It is very difficult to maintain, but I think we try to do that. I visited MGM last year, MGM Chennai, and some of you, if you would have visited, they have a green wall. So live wall, marvelous. So, the type of feeling when you sit in that atrium and have coffee is very different. We were fortunate to actually purchase this hospital from Hirandanis. So we have healing gardens in the hospital. It is actually a very good view for both staff and patients. We have resorted to some of the analytics when it comes to smart design, because before we finalize any of the layout, we do spaghetti diagrams. We see how much a patient and staff will walk. So because I was actually long time back part of GE Healthcare. We used to work in US and design hospitals. I picked it from there. So on an average, 2 to 3 hours a US nurse spends in walking, because the hospitals are so big. Indian hospitals are also getting big. So there was a study which says around 25 to 28% of Indian nurses and other care providers spend their time in walking, not in patient care. Leave apart other documentation and other stuff. So we actually do some analytics. We work out with our architects to see how much walk will be there. So we try to reduce the walk, cluster departments such that, one example is orthopedics and rheumatology has to be hand in hand. And then the entire renal sciences has to, these are basic things, again, being a hospital admission of student, form follows the function, and that is the base which is true. Anything which you build has to be as per the specialty and as per the need of the patient, because patient, that is the paramount thing. When we also talk about, smart hospital, it is about the technology. So, we try to integrate technology like Dragon software, we are going for Ogneto. So reduce the, non-value add or semi-value add work, because we just heard Sunoh. Similarly, we have at least software. And we have been trying to, integrate a lot of AI technologies starting from radiology. We are trying to, reduce work of our doctors. The other thing what I would say is that we have, Neeraj, I think I am taking a clue from this, but what we have done in our hospitals, we have provided multiple cafes. So when you talk about patient care, it is not only about patient, it is also about the family, extended family. So we try to have multiple cuisines in our hospitals, at least 4 or 5 of these cafes. And I actually got a clue of having these, days. But these are some of the things which, Kim stand for. And I think it is not always possible to, build greenfield hospitals. But whatever we can to make the hospital look less like a hospital, that is our endeavor, to improve the patient flow so that majority of the time caregivers spend on the care delivery, patient doesn't move, getting geriatric and orthopedics on the ground floor, because whatever lifting capacity or escalator you use, it will always be a challenge for geriatric patients and you cannot move. So, all these things we are looking for. Yeah, that's my.
Thank you very much. And I think, on a retrospective basis, if we see, we can do a lot of this technology integration even when you are operational. But one point what you told very nicely, that how many steps they are going to walk. So today, I know in US, in many hospitals, they are applying Toyota production system. Along with that, the lean management, and trying to see how do you get better productivity. And once your hospital is designed, I don't think you can go back and change that. So you have to be very focused from the beginning. On another note, considering patient as a guest, I know about a hospital, I heard a story about a hospital who appointed a hotelier in the front office, and they told, we are going to hope to see you soon. So that hospital has a tough time. So we have to be careful in keeping that kind of guest concept also. With that, I move on to Dr. Ahmad. I was little confused initially what to ask him, because he comes for several decades experience like us from hospital, but now he's in a different role. He has a hat of consulting, who is doing a lot of designing, not only in India, even in abroad. So question is, how do you create efficient design? You plan a hospital, because all of us, we know that whatever we plan to do, whatever we want to do, you are trying to add ingredients that comes at a cost. So the question to you is really a good design can make profit for the hospital, keeping the theme of the discussion in mind, and what can be done to make it profitable?
Thank you, Joy. Thank you, Healthcare Radius, and thank you, everyone, for being here. You've stressed on a very important point, and everyone's been talking about EBITDA, efficiency, smart, tech. That's all great. Fine, it's all acceptable. But who is the one who's giving the service? Has anyone thought of the internal guest or the internal customer? Nobody thinks about that, unfortunately, in India. And you asked me this question offline, what's the difference between the West and us? The West thinks of the internal customer. The West thinks for the nurses. The West thinks for the ward boys. The West thinks for them and plans the hospital accordingly. Every single hospital, whether it's a private sector, especially the private sector, will always cringe on the staff changing room, will cringe on the nursing station, and pack everything into that, from a refrigerator to a storage to everything. But the nurse doesn't have a place to sit. Now, if we start, and I run a healthcare consulting firm, we help in medical planning. One of the principles that we use for newer hospitals or redesigning old ones is having care for the caregiver. We make sure that the nurse does not have to cross more than 20 to 24 steps from the nursing station to where it has to be, even if that means duplicating a nursing station. And we convince the owner that this is only going to give you more bottom line. Because if internal staff is happy, they treat your guests, stroke patients, in a happier way. So I think while technology will keep on evolving, there will be a lot of new systems that come up, whether it's in radiology, patient experience. But the most important is the cultural change that we have to make sure that our internal customers are happy, design our places in a way that they are happier, ensure that the food given to them is not the downgrade. I mean, you add all these small things together, the outcome is going to be phenomenal. And while the mindset in India, "Arey, isko zyada space de diya," so what? In the overall scenario, you won't even land up giving more than 5,000 square feet. But that 5,000 square feet extra is going to give you such a bigger brand name and more loyalty for your own people, for your guests or your patients to come in. So I see there is something that we really need to adapt. We need to change our way of thinking. And that can only come with time. Things have evolved. Things have become better. And very honestly, the hospitals that we are doing, with this change that the EBITDA has actually gone up by 2 or 3%. So even these are existing hospitals that we've turned around just by altering spaces. So profit margins will always increase, but your people have to learn to be happy. Or we have to learn to make our people happy.
Thank you very much, and very important, and I must say that he used one sentence in between, that your caregivers, you have to keep them happy, and that is a very, very important thing, and that is changing drastically the entire delivery scenario, that it is creating impact on the design part of it. And we must remember that because they are there, then that is the reason we can make a better outcome, clinical, non-clinical outcome, that is possible. With this, I move on to my last panelist, Mr. Shantanu, and I kept a little loaded question for you. And the thing is, you know, this question comes to you because with your background, that India, in fact, our Prime Minister has declared net zero by 2070. In last 2 years, we have heard about sustainability. We have come out with ESG kind of thing, and all of us, whether you understand or not, trying our best to work towards that. So to you, I'm going to ask you a question. What kind of inputs you will have, and how a futuristic healthcare design can contribute in terms of sustainability in healthcare, because that is one of the major need of today. And I'm sure in this room we know that in a hospital per bed, the kind of electricity consumption, your water consumption, all are involved. So how do you make it sustainable?
Yeah, I think on the build side, I think, you know, firstly, when you look at sustainability, some out-of-the-box thinking, because we've done a lot of projects, And there are norms in place. When we work with the government, there is GRIA in place. We've got, awards for passive ventilation awards and all of that. That's on the hard side because you can actually calculate all of this and you get a rating. Yeah, so I'll come to that. But on the softer side, if you look at sustainability on the larger, on the society side, I think you can look at reduce, recycle, and how you look at waste and things like that. But if you look at the first point of just reduction and say, how do we actually reduce the load on the healthcare system itself? I think it's a larger conversation where hospitals actually were community hospitals which had a connect to society. And that connect somewhere started getting lost. And what I'm coming to is actually most of the diseases that we are talking about right now are related to lifestyle. Because anything that can push a vaccine into you will solve polio to everything. You can eradicate everything. But whatever we are talking about is a lifestyle problem, and a lot of it is related to education. So when our hospital becomes a community space for ourselves to learn and educate, I'm not a doctor, so I would love to learn more about healthcare. And more my interaction with doctors, I've realized there is a lot to learn. That's what I've realized. And that connection going away has actually pushed people away from the hospital, and we become outsiders. And we actually come only when we are sick. And now we have this disconnect between the hospital where we are we going to be charged too much money, which is, healthcare is expensive today, we know that. And how do you, if you're a regular community person, you will trust the hospital more, and you will be a patient also. When you're a patient, you don't want to be a patient. But when you're a patient, that is the place you go to. So I think, how do you reduce load on the healthcare system is by having a community-based hospital becomes the center which educates. I think that's how I would look at reduce in the paradigm of sustainability. I think on the harder side, what we do is, everybody knows water is a big issue. We have treatment plants today that are efficient, which can, relook at water as a source that you can replenish and reuse, depending on where you are and how much water you generate. I think it can come back into the system. Even heat can come back into the system. All of these technologies are being used today, and we have those paradigms that we are looking at. And I think in terms of when you look at materiality, something that you can reuse and finally you want it to go, even if it goes to, after the whole life cycle, if it goes down to Mother Earth, will it degenerate in the right manner? So I think when we look at these, the most important paradigm for a designer, we look at it as how does it help us as a, where it is, does it improve patient experience, sustainability? So it comes back to biophilic designs itself. And I think the closest building I would say is if anybody's been to the National Stock Exchange, we've revamped the entire atrium actually. It's got step terraces and it's got a whole large green wall actually. It's a 5-story green wall, which has completely changed the space in a way, because that is actually what we talk recycle, because air is something that you can recycle air with natural elements. So whether it's on Mother Earth or, the kind of build form we have in cities, we don't have Mother Earth all the time. We do get terraces all across the building. So this is another way where you improve experience of the visitor. In our case, it will be patients also, where you bring down the load on the hospitals with the stay time of a patient. Your recovery is quicker. And that's our role actually. So you're actually answering two questions here on how sustainability can then also improve patient experience and stay of a patient in a hospital. So I think these paradigms can be thought of.
Yeah, I think it is like a cycle. You do better, it gives you better yield, and you utilize that yield and you do better. So it is like a cycle, and thanks for emphasizing on that. So my next round of question to all panelists, I'll request you to be as brief as 60 to 90 seconds because we are running out of time. So I'll start with Professor Deshpande, and the question to you is, some of the panelists sitting here are coming from a brand new hospital, but here are hospitals which are running for the last several decades. If you really want to convert that into a future ready or so-called smart hospital, how do you manage without affecting the revenue, profitability, bottom line? How it is possible? Because you have done in your case some of the turnaround in this city, and we want to hear from you.
See, to actually change the anatomy as well as the functioning of the whole structure, you'll never do it in one step. because there are so many things which need to be attended to. Is a running hospital to stop it, unless and until you have many units across the city, in the same city, then you can actually transfer your patients to the other ones. But if you have only one unit, then you will never completely close that hospital. So you take element by element. One thing is exactly like what he said just now about the stock exchange doing only the atrium first and all that. I'm sure over a period of time, they will change everything, all the rooms, every single thing they will have to. So one thing is stepwise you need to do. Second is there is gap analysis which is done. So once you do a gap analysis, as far as all these things are concerned, all right, what is the requirement in space? Now you can't really create space, but you can make a existing space better. Energy-wise, you want to convert a running hospital into a green hospital, not so easy, but many steps you can actually walk towards it. Patient experience is to be improved, all right? So, patient guiding lines to guide them properly. The simple things people have done. You go to a Singapore hospital, you'll actually find simple lines drawn using sticking lines on the floor, so that, and if you want to go to physiotherapists, you follow this line. You want to go to the cafeteria, you follow this line. They don't even have to ask anybody, simple guideline. A hospital like Tata Hospital, there used to be such a big problem that all right, we are going there, but we don't know what is the problem with me. Where do I have to go? What exactly is it? So they just got so fed up. When I was there, the registration used to be about 20,000 patients a year. Today they are at 75,000. Area has just doubled. So it's like 4 times the number of patients. Area has only doubled. So they got a keyword program. So there are patient guides who are there. The moment a new patient comes, he's being registered, a person is actually standing there. He asks him what exactly is the problem, and then he guides the person through. Now they've advertised a graduation program also in keyword programs, patient guideline kind of this thing. Simple thing. We have a strength of population. We utilize that particular thing, and then we use that. Then other automation, various patient sensors, making it automatic, making things directly go into the central computer, using large data analysis, using that particular thing into treatment decisions, etc. Step by step, we all do that. So it is possible to do it, but it has to be a very, very designed program with set targets, set feedbacks, and set reviews.
Thank you. Quickly, I'll move on to Dr. Shilpa, and I know your hospital, Jupiter, has done some work on sustainability, green and initiatives. So can you tell some of the things what you have done in your hospital in terms of making it a future-proof?
So design and the space has been also one of the USPs for Jupiter. So we had ensured that while creating, for example, even ICUs, those are very well-lit areas. Those are all, to prevent that ICU psychosis very typically, we have ensured that every patient will have the window. They can actually see the outside. They can see the sky. That is how the spaces are designed. For every floor we have, in fact, Dr. Patankar is here. Our Pune facility is much more advanced when it comes to, utilization of space and green energy. So we have created spaces on every floor where there is a kind of atrium. There is a natural daylight coming in, which reduces also burden on your electricity. We have also invested in solar and the windmills. So that is also one of the ways by which we have actually ensured the energy comes from the green sources, renewable energy is there. So that investment is also going on. Along with that, in Pune, we have actually had a collaboration with the Swedish body, and we have ensured that the Pune facility, which was comparatively new as compared to the Thana flagship unit, where it is completely certified as a green unit, green hospital. So these are the things we are doing. With every new facility coming in, actually we are adopting this, that the natural daylight is more. We are having enough spaces wherein the lighting and all of the care is taken on. The energy comes from the renewable sources, and that reduces even the stress level for the healthcare workers, as well as patient healing is better. So these are the precautions we have primarily taken while designing the spaces.
Thank you. And with this, I move on to, again, Dr. Neeraj, and question to you is that, we have seen the fluctuating demands of the patient number and staff. So how do you create a workspace which is meeting these fluctuating demands as well as your staff requirements and availability?
So you're talking about staff. So say for example, I recently shifted to Mumbai. So I went to a BKC Apple store, right? So what they do after a few hours, they have a show for you how to click a photograph, because I think most of the people are not making use of a phone to the maximum potential. So that is a very good thing. So in one of the hospital in Ahmedabad, what I have done, we've created a space where a patient attendants, like every patient got their brother, sister, mother, father waiting for them. So they generally get bored. You know what to do throughout the day. There is a duty, you have to go with them. So what we have created a place where they can go. There's an open space. One of the doctor, a nutritionist or a bariatric surgeon, they're talking about basic health hygiene, how to take care of yourself. We serve them a tea, coffee and a cookie. So now we started, 20 to 30 patient relatives are coming, and at the scene we have seen around 70 to 80 people between 2 and 3. They come, they sit with them, they chat with the people, and every day there is a different show. Different show means health, hygiene, nutrition and all. So I think it is very, very important. And I think these days we all are passing through a phase where a certain number of patients you have to take care of schemes, like CGHS schemes, PMJY and all. So what to do with them? You have to have them. So, and it's very, very difficult. So like whenever we fly, so there is a lounge, you go there. So in order to promote our cash patients, we created a cash lounge. So I'm waiting, I'm a cash patient. My parents or my uncle is there, so I can use that card. I can go in the cash lounge, I can free Wi-Fi, I can have tea and coffee, and it is connected with the patient room, smart room. So whenever there's a requirement, they can go and talk to them. So if we create these kind of spaces in the hospital, patient experience and in fact the patient attended experience improve, because those are the people who give good experience. And you can earn on revenue and you can have a good feedbacks. So I think if these kind of things can be done, they can, patients are also happy, their relatives are also happy, and you have less billing hurdles.
So quickly move on to Dr. Saurabh, and question very simple. Your Ahmed mentioned about, caregiver experience, and Neeraj has given enough number of experience in terms of what has been done in their hospital, earlier hospital. So to you, what elements you try to incorporate to see that the stress level of patients or the workers are less? Just in a brief, if you can touch upon.
So some of the elements which Neeraj has said, we have also incorporated. We also have lounges. And what we also do is we actually try to involve the caregiver's family. So we have regular family days. Now, what we have done is, before opening the hospital to the public, we opened it to the internal customers, because that is the most important thing. We wanted somebody, some kids to see where their mother and father, they are working. So we invited everyone. And believe me, that was a very appreciated step. We, welcome all our, this particular thing came from IT industry, but whenever somebody joins, they are, business cards, there is a joining kit, just like they give it Infosys and other. So we give it to doctors, so small things we do, but I think we are still, we're still not there as healthcare. We are still lagging behind. If you talk about other industries, how they, try to de-stress their employees. Because we also, in some of our hospitals, have gyms for, hospital staff and doctors where they can go. So those are some of the things which we have tried to do.
Thank you. And I have two more panelists. Quickly, I'll go to Mr. Shantanu. And one of the questions what, bothers us, or rather, it was a major challenge during the COVID time. Many hospitals turned out to be non-compliant to the requirement of handling those kind of patients on those days. So what are the learnings you had and what you are trying to incorporate in the upcoming hospital which are future ready?
Yeah, I think I'll just put it briefly. Firstly, we were very busy at that time because we work in healthcare, yeah? And the first thing we got is every hospital saying that we've seen the upsurge of so many people, not only people and patients. And how do we deal with it? Because all facilities are maxed out always, and then this was beyond maxed out. So some out of the box more than that were jugaad thinking. So we looked at all the facility mix, bed mix and said that where do we put more people? So started looking at podiums in a building, started looking at parkings in a building. Some people had more land, they could offer it to COVID centers, government certified centers. So people were very generous, people were willing to do. So what are the technologies you would use? Rapid build technologies, sometimes looking at tenting technology. So we were looking at technologies, we were looking at redundancies, we were looking at systems that you could, deal with that we had never thought of. So it was quite a time, and it was kind of a global emergency. So, but that thinking is actually now started improving the way we look at HVAC. We're looking at, somebody will look at only positive ventilation. They said, no, let's have negative too, so we can swing. And if there is an emergency, we have to be resilient. So I think the word resilience is now built into our, what we had a room data sheet, if anybody knows what that looks like. We know what we wanted in each space for technology and infrastructure. Now we have to build for resilience. So there is always a component. Every hospital looks at it, it's 15%, 20%, but that has come into the room data sheet, which is a very good sign as we go. And if we have any other emergencies like this one in healthcare, I think we should be prepared.
Thank you. And
adaptability. Thank you, Amjad, my old friend, always there for me, supporting us.
So Dr. Mecklai, the last question of this panel discussion to you. Though you have told we are self-sufficient, we have shown the resilience, we have shown that India can show the way for the rest of the world. But if you can, from your experience, talk about few learnings from Western world, what can be still brought into Indian scenario?
Joy, that's a very good question, because if you actually go to see, I mean, one of the companies that I run is also a medical value travel company, and India's first NABH certified company. You are seeing the Western world coming here. So one question is, your clinical outcomes are superb. What they are lacking is the hospitality part of it. What they are lacking is the comfort. What they are lacking is getting the local protocols in place. So I think India is at a stage where things are done right and all these components are put into place. We can do wonders. And I'm not kidding. It's what I've heard is for 2025-26, there's an estimated income of $38 billion only on medical tourists coming to India. So I think we definitely have the potential. It's just putting the heads together and moving ahead.
So you are ending with a very positive note that India has a lot of opportunities in coming days to get patients from the international market, getting good business, and at that time, if you have a different look and feel in your hospital, you design in such a way, then automatically profit will arise. So with this note, I want to thank all my panelists, and I'm sorry to the audience that we have gone at least 10 minutes beyond the scheduled time. So you can have interaction later because all the panelists are going to be here. So with this, I want to thank Healthcare Radius for giving me this opportunity, and thanks once again to all the panelists for joining here and sharing their thoughts. And a big round of applause for them.
Thank you so much to our session chair and our speakers. Can we have a huge round of applause for them, everyone? I would request the speakers to please be on the stage. And now I would request Mr. Akash Shah, Director, India, eClinicalWorks, to please join me here for felicitation. So I would request Padma Shri, Dr. Ramakant Deshpande, to please come here for felicitation ahead. Our session chair has been felicitated. That's why we're going ahead with the speakers. Can we have a huge round of applause for him, everyone? Next, I would request Dr. Ahmad Mecklai to please come ahead. Can we have a huge round of applause for them? Next, we have Neeraj Lal, requesting you to please come ahead. Once again, a huge round of applause, everyone. Next, I would request Shantanu Poredi to please come ahead. Let's hear it for him, everyone. Next, we have Dr. Shilpa Tatake, requesting you to please come ahead. Let's hear it for her, everyone. Next, we have Saurabh Gupta. Once again, thank you so much. Requesting you to please stay for a group picture.